Hello everyone, this is Dr. Humanist again. Let us now discuss about myxedema coma. As we all know, it's life-threatening manifestation of severe hypothyroidism, which is characterized by marked reduction in the metabolic activity. Okay, leading to the clinical presentation like altered consciousness level, and leading to even stupor and coma. Seizures can be there and hypothermia, as low as temperatures less than 23 degrees Celsius. Other symptoms like bradycardia, hypotension, hypoventilation, hyponatremia, and hypoglycemia symptoms are there. Physical examination, you will get non-pitting edema, that is myxedema, coarse facial features, dry skin, hair loss, and hoarseness of voice. What are the risk factors? Almost, always it will present in the elderly. And precipitating factors, you have to address even that. You have to treat that. We have to see what has precipitated this event. So, commonly respiratory impairments or any drugs like sedatives, anesthetics, antidepressants, or any infections like pneumonia or UTI, or any cardiac disorders like congestive heart failure or MI, gastrointestinal bleeding, or a stroke. Okay, or any infections. Sepsis should be suspected whenever the patient comes with the history of fever and all. Environmental, like exposure to cold, can be a precipitating factor. Metabolic, like hypoventilation, hypoxia, hypercapnia, hypoglycemia, and dilutional hyponatremia. So coming to the investigation, in lab investigation, in thyroid function test, you will find that elevated TSH and low T3 and T4. Okay. Blood gas analysis to monitor for hypoxia or hypercapnia. Electrolytes will see hyponatremia, hypoglycemia. CBC and blood cultures if you're suspecting for infections. Cortisol levels to address the adrenal functions. Coming to the imaging, chest X-ray to see if it's pneumonia, if you're suspecting for that. ECG, you can find bradycardia and other cardiac abnormalities. CT MRI if you're suspecting for stroke. Clinical history. Okay. So what we'll find is poor compliance with the thyroid medication which the patient is on, like hypothyroidism treatment. Physical examination will find the signs which are consistent to severe hypothyroidism, like bradycardia, hypotension and all. Mortality rate is high, 20 to 40% despite of intensive treatment. Okay. Now coming to the management, so thyroid hormone replacement, first you have to address, that is first levothyroxine. Initial bolus IV dose is 200 to 400 microgram. After that maintenance dose, you can start on oral 1.6 microgram per kg per day. That is usual dose we start on the patients of hypothyroidism. But if you are using this as IV, then you have to reduce the dose by 25%. An alternative to this, if the IV is unavailable, then you can go for nasogastric tube and then putting the drug. Next is levothyroxine. You have to use less dose as it is highly active and short half-life. 5 to 20 microgram IV or via nasogastric tube, or after that maintenance is 2.5 to 10 microgram every 8 hours. You have to use lower dose with the patients which are older or having cardiovascular risk. Supportive therapy, like temperature, if it's hypothermia, especially if the temperature is less than 30, you have to do external warming. You can use space blankets for that. Hydrocortisone, you have to give 50 mg every 6 hours to address the impaired adrenal reserve. You have to treat the precipitating factors also, as like if there is infection, you have to treat with the broad spectrum antibiotics. Ventilatory support if hypoxia and hypoventilation. Fluid management, use hypertonic saline or IV glucose. If hypoglycemia, hyponatremia, you have to treat that. You have to avoid the hypotonic fluids like 0.45% NS and all. You have to avoid to exacerbate the water retention. Medical management, you have to reduce them as there is a reduced metabolism. You have to consider the dose alteration for if any other medication if the patient is taking, because there is impaired metabolism. You have to consider the reduced metabolism state. And sedatives you have to avoid. Okay. Monitoring, you have to monitor the patients, all these things like thyroid function test, and decide the dosage of the drugs. Thank you.